You may have heard that healthcare reform is a big deal in the US. Well, for members of the American Medical Student Association, it definitely is one of our top priorities. With over 1 million medical bankruptcies every year, mostly among people with health insurance, with 47 million people without any health insurance, with American businesses every day going broke because of healthcare costs, and seen in the clinic patient after patient not getting better because profits, not patients, are the priorities of our system, we know change is needed. But what change? It seems that everyone has a theory about how to make our system better. So we decided to take a look for ourselves and take a closer look at our neighbors to the north and see what they're up to. From February 6 through 10, 12 medical students from all over the US came together in Seattle and Vancouver for AMSA's 5th annual Seacouver study tour. Our mission was to gain a better understanding of our own healthcare system in the US and learn about how Canada organizes its healthcare. We had amazing opportunities to discuss policy with healthcare experts in both Seattle and Vancouver, meet government officials on both sides, and interview normal, everyday people shopping and working at Pike Place or Granville Island farmers markets about their experience and attitudes with each system. Today, we are glad to share this experience with you in this video, and we sincerely hope you too can one day go yourself and get some ideas about how to improve healthcare here in the US.
I believe it's lacking. I believe that there should be more alternatives and it should be easier accessible to everyone, and alternative medicine should be involved in most insurance policies.
I think it is generally like a rusty bucket. I'm not really that impressed. I, for years and years, have been one of the millions of uninsured folks, as most single people I know are, but actually I know lots and lots of families that, you know, their kindergarten and preschool age children have no health insurance because it's prohibitively expensive. You cannot, you know, making ends meet does not involve having health care in this country, basically. So it's basically keeps the poor sick and therefore poor, and really kind of does disservice to working middle class families who are trying to make a better life for their kids. So,
well, my thoughts on the medical care is I think that's lousy, to use a simple word term. Very ineffective, misses the point in terms of maintaining the health of the citizenry, and lines the pockets of medical businesses.
I think it stinks. I feel like those who can afford it, it's great for them. I think they have good health care, and I think it's great that students can have usually good health care at the student rate, and that's the situation that I'm in right now. But I think those who can afford it, they really miss out. So yeah, there's a lot of things I'm not a fan of as far as that goes.
I think we leave a lot of people behind in the U.S. plan. I think it's sad. And I think it's overly expensive.
You have to have your checkbook when you go into a hospital. You know, doesn't seem to be a system in place like we do have in Canada. Yeah.
Do you know of any Canadians who have gone to America?
Yes, yeah. I've heard some horror stories where they've been in accidents down there, and they've just lost everything, gone bankrupt and everything because of the American system. That is for sure. Yeah. Okay. And especially I knew somebody that was in a car accident, and they had to sell everything off.
As far as I understand, if you can't afford to be sick and you're sick, you're kind of screwed. Like you would wind up, like, let's say cancer sick. You would wind up basically draining. The resources of yourself and everyone around you. And I have heard of cases of like people, you know, having to mortgage their house in order to pay for chemotherapy to keep themselves alive. And it's like, gee, now I'm alive and I can go live on the street. It's like, what? You know, it is a little bit mind-boggling.
The American healthcare system, from what I've heard and what I've seen, it's a little bit scary because of people who need the care don't always get it because they don't have the finances to get it, and that I think is unfortunate for sure.
I don't know how people do it. Like, unless you have a job that covers for medical, people lose their homes. I don't know how they do it. I don't know how you guys do it.
I know that they are like always trying to look at our system to find ways of making it better down there.
I would change the way that we view wellness and put more money and attention to how to stay healthy and have some of those services paid for.
To turn to the patient itself and trying to get him better or preventive medicine or something like this, and cut the expense out. The expenses in the hospital are ridiculous.
Right. I think the access to whichever doctor you want to go to should be one of the issues that should be contemplated as far as being able to choose your own healthcare provider.
I'd probably like to be more efficient and cost effective. Said the Canadian system actually sounds really good because my roommate's Canadian, and from what she said about it, it sounds great. Just like being able to get the help you need.